So Luba is a pharmacist. She's a PhD and has her master's degree, and she has owned her own pharmacy. She lives and works in Illinois and especially focuses on senior citizens. And that brings her to the topic of interactions with lots of pharmaceuticals as well as the cannabis. So Luba's here to tell us a little bit about interactions between pharmaceuticals and cannabis and how to work with seniors.
Well, I'm not a PhD. I ended up going back to Loyola Law School. I'm an MJ, so I have a master's in jurisprudence. But thank you. That'll be my next life now, to be a PhD. That'll work for me. Well, yes, I did own a pharmacy in the 80s, moved on, went into long-term care. So I have 20 years plus in retail, 20 years plus in long-term care. And now I've discovered cannabis about 5 years ago. Yes, I have to tell you this. I am the founder of an Illinois coalition, Mature Approaches to Cannabis. I found that the 55 plus generation really needs us, needs all of us as being the clinicians. They're used to going to the pharmacist, they're used to getting a prescription, and they're used to talking to somebody about their medications. So I have this new coalition. I am also co-founder and principal of 2 Illinois medical cannabis dispensaries, which is very exciting. I'm not going to explain all this, all yesterday and today. You've got all the explanations, everything is here for you. Oh, by the way, I have to tell you, my glass on, it's American Pharmacist Month, so know your medicine, know your pharmacist. Just a little plug for any pharmacist in the room. So important. And what also is important for all of us, not only for what's going on here today, and thank you very much for inviting me to be here, but you know, for all of us as clinicians, we need to provide, prepare, and challenge. Provide an overview of medical cannabis to the physicians, to other clinicians, to patients, just at parties. People want to talk about it. Prepare, we need to prepare discussions. Do we have a script? Do we have anything to say? And make sure it's important to when we reach our healthcare professionals. And it's a challenge. I've been challenged many a time. I now have a consulting company, and I do education in physicians' offices. I will make the appointment with the doctor and everyone there, the MD, whoever's there, the NP, PA, the staff. I give them probably anywhere from a half hour to a 1 hour presentation. Sometimes it gets very heated up and it's gone as much as 2 hours. Again, the uses for medical cannabis, we've seen this, we know this over and over. I like this slide because a goal without a plan is just a wish. This is how, whenever I approach any of my patients or my doctors, this is how I explain things. And now that title I got from one of my friends who is also a physician, Dr. Gaziano, and he has an entire chapter on a goal without a plan. But what do we all want? We're first looking for a positive outcome. That is our goal. You know, here my rule always says no outcome, no income. So kind of remember that. How do you get to that outcome? You need to educate. We need to educate ourselves, and we need to educate the physicians around us, the patients around us. It's so important because everything changes. I know this is the Wild West, and I know that every day I learn something else and something more. I tell many of my patients that going to pharmacy school and going to law school was much easier than learning everything about the cannabis world. Individualize, again, telling the doctors that your patients are going to have to individualize how they're being treated, what they're taking, how they're taking it. And the same thing with the patient. I have many patients call me and they're asking me this question. You know, because I'm the pharmacist, I'm supposed to tell them take 1 3 times a day and call me in the morning. Well, it's not happening that way. I'm telling them exactly, you know, you have to keep a log of what you're doing. Everything throughout, even put down what the weather is. Maybe the weather was bad that day, and that's why you're not feeling right. The entourage. Again, you have to explain to everybody what part of the plant are we using. Are we using the CBD part, the THC part, or the entourage? Learn about it and learn the entire beauty of the entire plant. And experiment. This is another thing. I just spoke to a pain doctor the other day. who this morning sent me a patient. I have my pharmacist, and I've got Clara here, so the pain doctor that I met at Northwestern last week has now sent me a patient, and I'm meeting her on Saturday. Just an extra plug there. How difficult it is to get through to the doctors and explain to them and teach them. And tell them that it is an experiment, and tell them that your patients, they have to experiment. What works, start low, especially, I told you, I'm with my seniors. I don't like to use the word senior because no one wants to be a senior unless you're a junior in high school. They're my mature patients, and I treat them as mature patients, and even when they like too many gummy bears or they eat too much chocolate, and they tell me they just slept 14 hours, but it was the best sleep they've had in years. One of my other patients was going to Europe, and she wanted to know how she could take her gummy bears with her, and I said, la 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 la, I'm from Illinois, we are the most regulated, you leave your gummy bears home. And I said, where are you going? She said, to Europe. Where in Europe? Amsterdam. No problem. Take your gummy here, leave everything behind, you'll be fine in Amsterdam. 3 kinds of pain. We have the nociceptive, neuropathic, and the central pain. Your nociceptic is a sprained ankle. Your neuropathic is your back pain, MS, a muscle spasm. And the central pain is like fibromyalgia. Now, I owned a pharmacy in the 80s. Somebody came in with fibromyalgia in the 80s or even early 90s. Was like, yeah, sure. That was our response was, what is it, fibromyalgia? You don't want to go to work, there's no such thing. Well, we found out that there is such a thing, and we found out that it's being treated. Fibromyalgia is the most common complaint. Again, this is Illinois. I'm talking about Illinois, but I think that as of last week, with a new survey, it's no longer fibromyalgia, and it has become PTSD. So yes, as of last week. So what is fibromyalgia? Well, it's an imbalance in the hypothalamic pituitary adrenal axis. And we find out that cannabis has the ability to balance this delicate hormonal attraction. So here, I just introduced you to Jehan. He'd like to speak to you today. Yes, so Dr. Jehan Marku, Chief Scientist with Americans for Safe Access. He says that cannabis is a key in a lock to your body that exists for a reason. He said we send in the cannabinoids to activate the system that's supposed to be working. It's sort of a care and feeding of the endocannabinoid to do its job. How does cannabis interact? We've been hearing this all day, and there have been some amazing doctors speaking on this, so I'm not going to tell you too much more, other than THC actually treats pain by eliciting a state of euphoria. CBD works as an anti-inflammatory and mood stabilizer. Cannabis-based products, so exciting for all of us this year with Epidiolex. That means, I feel as a pharmacist, for us it means, okay, we're getting recognition. Cannabis is being recognized, and it happened this year, it happened June 25th, so here's the FDA, they said, all right, we're good with you. It's an oral seizure medication. Come September, DEA said, all right, we're with you too. So again, I feel that is so exciting for all of us. Even it's Schedule 5, again, that means that we have a drug. We have a medicine. Cannabis is medicine, and it's being recognized. Epidiolex is unique because its primary ingredient is a natural, it's the natural compound. It is the CBD. Other products on the market, for those of you who are pharmacists here, who have, in 1985, it was so exciting. I owned my pharmacy then. Marinol was coming out. It was going to be the it. It was not. It was not. It just went straight down. I filled it so many times, and I guess you kind of look at a fill, as a pharmacist, I'm looking as a refill. I didn't have to refill it, hardly ever. Patients complained about it, and it was at that time there was no managed care, no insurance, it was all out of pocket, and they said it's not worth the money. Kesamet came out in 2006, Syndros 2017, and we have Sativex and Epidiolex this year. Again, very exciting. Marinol treats nausea, Kesamet treats nausea and pain, Syndros nausea and vomiting, and helps treat weight loss. Dronabinol is FDA approved for chemotherapy, induced nausea, vomiting, and anorexia with AIDS. AIDS? Did I just say AIDS? Yes. AIDS or cancer. If I start speaking Ukrainian to you, okay, just raise your hand. Because sometimes I find myself just going into a different language and everyone looks at me. Although last week I was speaking in Long Island University, and so I thought I was going to be so cool, right? I come out there to the students. There's probably a couple of hundred of students in this auditorium, and I tell them, I am not Cheech and Chong. This is what medical cannabis looks like. I had a flat look. Later on, the professor told me, they said, you know, Luba, there was probably only 2 professors understood your joke. Nobody in the room knows what Cheech and Chong is. I said, okay, I've taken that one out. So for those of you who don't know, look them up, Cheech and Chong, they still make movies. The other thing I did, being from Chicago, I was talking about my patients who are buying illegally their cannabis. And I mentioned, you know, so I asked this patient, did you buy your cannabis in the gangway? And he said, no, my dealer now works in the park. And I thought, oh. So again, flat face. There are no gangways in New York. They didn't know what a gangway is. So I don't know, there's gangways in Colorado, but we have gangways, that's the space between 2 buildings. And so I'm not going to use that one anymore because I see these flat faces here too. So okay, no gangway. Pharmacokinetics, we've been hearing about the pharmacokinetics. We're looking at the dosage forms, plant, concentrate. Do you want to smoke it? Do you want to eat it? Do you want to swallow it? Whatever. The duration, very important. These are questions I get. And then also the metabolism or the half-life. So, I'm just going to breathe through this because we've got the oral, capsules, tinctures, infused water, infused Coca-Cola, Pepsi-Cola is coming around. So, are you ready? The onset, the duration. I had to learn what a volcano was through one of my patients who called me, said my doctor told me to get a volcano. And so then she calls me, she says, I paid several $100s for a volcano. What is it? I said, I'll find out right away. And so I had to call somebody to explain what a volcano was. I knew everything else, but a volcano? It's what it is. So the onset, she ended up not using it, didn't like her volcano. Chocolates. This is my lady who slept for 14 hours. For those of you who were not here earlier, she loved the chocolate. Her daughter left her chocolates. She had a little bit of her chocolate, and then she had a little bit more of her chocolate, and then she had a little bit more of her chocolate, and then she woke up 14 hours later. Again, the best sleep she's had. The gummies, my lady traveling, the mints, they love the mints, cookies. And so there's your onsets and duration. Again, the ointments, lotion, cream, gel, patches. I do have a video out there called Clarity. I did a study with 5 patients in a memory care center. So these were 5 very demented patients. And we started them on cannabis. And, you know, thought, put a patch on, right? That works. That's, you know, you don't have to bother them. You don't have to force anything down their mouth or make them drink whatever they don't want to drink. So put a patch on. We only had 1 patient with a patch. Well, put the patch on. Where is it? We put it on the wrist. The nurse put it on the wrist. It's not there. Check. Let's do a body check. It's not there. It's on somebody else. She decided to remove that and share it and put it on somebody else. So I'm always, you know, patches are, just don't use it in a memory care center. But they responded amazingly. If you ever get a chance, it's called Clarity. It's 20 minutes, and it's just an amazing video. It'll make you cry at the end. We had interviewed families, the DON, the administrator, doctors, but the best was to watch the patients who really woke up. One even enjoyed what she was eating, where she was nonverbal for the longest time. Suppositories, again, the rectal and the vaginal, we've been hearing some great things about them, and I'm always recommending the suppositories. And the first time, especially the men, the women are okay with everything, but the men are like, I'm not going to do it. Just do it. Just do it, you'll be okay. And then they call me back and say, you know, this is really, it worked amazingly. This is the best stuff, like I told you. So, Allergies, yes, there's burning eyes, pink eyes, watery eyes, coughing, dry mouth, rhinitis, you got the runny noses, the skin rashes. Those are mostly in the people that are growers where they're handling the medications, the grass. And asthmatic symptoms, I have had complaints about patients that do have asthma, who have any type of upper respiratory issues. They do not like the vape, and of course they're not smoking. Identify your drug interactions. This is one that I think as pharmacists we get a lot of calls on. And what I have developed is a 3-page form. And when I meet my patients, many of my patients, I will go to the dispensary with them. I am not behind the counter. I am with the patient. I get a whole list of their medications. I do a drug analysis for them. I do a drug interaction with them. I add the cannabis in there, and then that form with my recommendations on titration, on reduction of drugs, I then submit. I give a copy to the patient, and I ask that they send a copy to their doctor. So the doctor has that on file, so that doctor knows that this patient is on cannabis. Because a lot of times you have, especially with your 55 plus, they have multiple physicians. And a lot of times they don't want to tell their doctor that I'm on cannabis, or they just kind of keep it quiet. The other one I was just told, surgeons and anesthesiologists, I had a hospital call me about that they're hoping that the patients, on the report, when you tell the doctor what medications you're on, you have to say you're also on cannabis. The one surgeon said, I'm finding patches on my patients and I didn't put it there and I don't know what it is. And I said, well, so the problem I'm seeing is not with the patient, maybe with the questionnaire that's given out in the hospital. So there's cannabis, prescription medications, our OTCs, cannabis and food. The drug interactions, I did this slide I did especially for my students, because I knew there was going to be some student that's going to look all this up on drugs.com and tell me that this is what they saw, how many drug interactions there are. So I pulled this out. This is verbatim right out of drugs.com with 609 drug interactions. But most of them are, because they're with a drug-drug combination, they're mostly the drowsiness is caused from antidepressants, alcohol, antihistamines, sedatives, pain relievers, anxiety medications, seizure meds, muscle relaxants, and more. Enzyme, I'm not going to go through this, but for the pharmacists in the room, we're always looking at this cytochrome P450, the interactions, what do we do, how do we work, what are we looking for that patient for benefit. Drug interactions with cannabis. Now this came from Medscape. I'm a Medscape person. That's where I usually find all of my drug interactions, or Hippocrates, but I found that Medscape gave me more information. So the opioid medications, you got your morphine, Narcos, Suboxone, drowsiness, oversedation, confusion. We know this. We know this. We see this. Using cannabis in conjunction with morphine lowers the required dose of morphine. So again, we're looking at titration, reduction, where are we going, where are we as pharmacists, as nurses, as clinicians, as people that understand what is going on and understand the medications our patients are on. Antipsychotic, you got your Seroquel, Abilify, Clozaril, Geodine, Zyprexa. Cannabis can heighten antipsychotic drugs. Again, we're looking at doses. We're looking at doses, dosages, how often patients are taking this, what they're taking, how they're taking it. The symptoms, again, excessive sedation, slow motor skills, decreased cognition, and impaired driving. We have our SSRIs and SNRIs. The last few months, I've also been helping patients get off of some of the drugs. I'm just working with a patient. It took me 3 months to get this gentleman off of 6 Norcos a day plus 6 methadones a day. Yes.
Can I ask one quick question?
Yes.
Because everybody talks about this, but we never hear dosing levels. Are you talking, is it vary for every person? Like
Dosing levels of, you mean of the
cannabis?
cannabis. Always start low.
No, I know.
Yeah,
What does
okay.
that mean, though? Always start low.
Well, okay. Well, let me explain to you with my Norco guy. That's a very good question, and then kind of a good opening for my Norco. So I have a 90-year-old man And he's on Norco 10, but he gets 6 of those a day. Hello. And he's on methadone, and he gets 6 of those a day. I was doing a presentation, myself and the 2 ladies that are sitting right here with Carmen and Ann. We were at a independent living facility, and the wife came to me after and she says, you know, can you help me? My husband is on medication. Oh, sure. Oh. When she gave me the list, I'm like, oh, sure. That's not what I said, but yeah, something like that. I got the SH in there. And so she said, can you help? And I said, well, let's do it. Again, I'm from Illinois, so it's 90 days before anyone can get a card. We went through the process of getting the doctor to fill out all the medication, all the forms. We filled everything out. What I did for them though, I said, you leave him on what he's on. Let's kind of watch him, but why don't we just put him on a little CBD? And just so he's going to get used to taking a CBD, you know, sublingually, and maybe you could start reducing the Norco. I wanted the Norco to go first.
What was the dose?
I think I started at 10 milligram, just a little bit, because I'm still not ready to touch the Norco itself. So comes the card comes in, she says, could you go with me please to the dispensary? I go in there and I already have the list of all of his 15 medications, not counting the Norco, yes. I'm friends with the doctor now. So we went through all of that, and so what are we going to do with your husband? Well, what is he going to take? Is he going to vape? No, my husband will not vape. What else are we going to, well, let's start with a little dessert. Shall we give him a little dessert? Yes, so we started with him, we started with the chocolates. And so we started with 5 milligram of the chocolates.
THC rich.
Right? Correct. And so she's asking me, what am I going to do? And I said, well, let's start with one of those Norcos at night. Let's do it kind of backwards. So we did. So he had his methadone at night, and he would take 2 Norcos at night. We reduced it. We had 1 Norco. Now a little bit of a chocolate for his dessert, and then we did this for a week. Kept it up. I'm first looking to see that there's no allergy, no side effect. I want to see if there's, we're putting on something, a new drug, and I need to see what's going on. So, I mean, we did this very slowly. Every 5 days, I said, all right, let's take off a Norco for lunch. Let's leave the morning, because they're very stiff. I mean, the pain is always, for my 55-plus-year-olds, pain is really bad in the morning. Reduce that. We finally, it took a while, it took 3 months, this reduction and titration. So now what am I doing with the cannabis? So he's got the 5 at night, and then I told her once we have only one Norco at lunch, 1 Norco in the morning, we are now taking another, we're titrating the cannabis. We have 5 in the morning, 5 at night, 2.5 in the afternoon, because he's still getting the Norco. So we did all this, and how is he feeling? Everything was fine. He's doing good. He does not miss his Norco.
How much CBD is he taking?
It was 1-to-1. So it was all very low, and so it just whatever. This man was, I was delighted. But again, if you know, the senior, I wasn't going to use senior, the mature patients, they respond better to a lower dose. They may not respond as good to a higher dose. So he was doing really nice. He joined a choral group. We got him off of his Norco. He had an amazing bowel movement. We stopped all of, which is a big deal. He had been, hadn't had one of those without 4 laxatives. Got rid of all of that. We're moving along. As of last week, I have not received a call from her because I go with her constantly. He did have some pain when we were down to 2 methadones. So I alternating 2, 3, 2, 3. Let's kind of see how he's feeling, especially in the mornings. Now I said, let's go back to the dispensary. There's a new gel that's out. It's pretty potent, has a lot of THC, CBD. I wanted to say it was like 90 milligram. But it's a gel, it's topical. I said, what I want you to do is before he hops out of bed, this is where he needs to put the gel, a little dab will do you down the back, down his leg. So he started doing that. We are, as of last week, and I'll probably hear from her today, she's probably, you know, we're having some psychic thing here. He's down to 1 methadone a day. I have also recommended other reduction of other medications. I didn't like his statin dose. I thought it was ridiculous that a man of that age is using 80 milligrams of simvastatin. Hello. We reduced some other medications, watched his antihypertensive drugs, and there was no more sleepers he didn't need. He's singing, he's, you know, he's pooping, he's singing. That's what you want when you're 90, right? So, that's what you want. Again, with the SSRIs and the SNRIs, there is a serotonin syndrome, memory impairment, so we know that, but that's also happening from high doses. Now, again, being from Chicago, I did receive a call from a nurse. Actually, there were 2 different nurses, 2 different occasions, in both situations, brothers. They're totally unrelated, totally ethnicity, everything is totally unrelated. They may have had the same dealer, and they were not going into a dispensary. They were buying from not the guy, probably the guy in the gangway. Now that you all know what a gangway is, so it's a guy in the gangway. The one young man just had a horrific experience with what he got, and he ended up in a psych ward. In an MI institution. Just really, it was so bad that the family had to admit him and put him on lockdown. So what happened here? He was on some bad stuff, and now they put him on, for those that know, a very high dose of risperidol, 8 milligrams a day, which is a very high dose. My other gentleman, another nurse calls me about her brother, and he's also bought some potpourri that he's using, and has turned totally paranoid, and the wife was deathly afraid to be in the house with him. There's a new baby in the house, he's closing all the windows, he's closing all the shades, he doesn't want to leave. So, as a pharmacist, it's my obligation to say 2 things. I'll call the police, or take him to a rehab center, take him to a hospital. I said, don't worry if you call the police, they're just going to take it. They will take him to a hospital, they will help him. The fact that the wife has to say what's going on. Or you take him to what we have, a rehab center, and so they decided, she talked to the husband, and that's what they decided to do. So they bypassed the police, they both went together, and she's very supportive of him. And they went to a place called Rosecrans. I'm not sure if you have Rosecrans here, but we have a few of these throughout Illinois. Benzos, I get a phone call from California. The lady is on, she was on alprazolam and Xanax. She was on Ativan, lorazepam, and she wants to get off. So again, I titrated, slowly told her, I said, just relax, tell me what's going on in your life. And it took her, she wasn't on super high doses, but she wanted it. She needed it. She needed that. Everybody needs the Xanax, right? I hate that drug. I hate that drug. So, but as she, we started, reducing a little bit, got rid of, I wanted to give her the Xanax first. I think that's an uglier drug. And then slowly got her off the lorazepam. She got down to 1/4 milligram. And then she told me, I said, are you ready? She said, not yet. I said, okay, then leave it alone. You're 1/4 milligram, that's nothing. Just leave it alone. But one day, you'll be ready, and when you're ready, do every other day, and then do every 3rd day, and then just stop it, and stay with your cannabis, because she loved the cannabis. All right, beta blockers, we know there's, yes.
One more question.
Yeah.
The dose of THC as well as CBD.
Yeah.
Just when you're eating an edible or doing a tincture, but let's say an edible, that will start to cause drug-drug interaction. 20 milligrams, 30, 40, 50, and where you may have to do blood levels or something like that, or you can't tell. Does that vary with every person? Can you give me a general idea?
Well, on my mature patients, and I'm strictly working with the 55 and over. That is my group, and I have not used such high doses on them. They seem to be, my people, they seem to be responding very nicely on a low dose.
What low dose?
Yes, or if I needed somebody to be at 50 milligram, I would definitely microdose them and tell them to do multiple small doses through the day. I would not tell them, you know, go for it.
But I'm saying you're not seeing interaction with the CYP 50, 450
No.
on those microdoses?
No, not on the microdosing, no. But then again, don't forget there are other medications, the doses are coming down. So if you're taking a high dose, or you're on, let's say, 4 antihypertensives, we talk with the doctor, and then as that has to start coming down, because they're going to be on the floor. They're going to get dizzy, and they're constantly falling. And a fall in that age means a break. A break means, you know what that means, especially in long-term care. You're dead in 6 months.
But the question is still, if somebody's taking 50 milligrams of CBD from hemp products every day,
yes.
okay, is that going to interfere with some medicine that is going through the CYP 450 system? That's all my question is all.
It will interfere, but you have to reduce the dose.
Okay.
Is that what there will be some, yes,
at
yes.
50 milligrams, at 40 milligrams, at 20, 80?
Remember, well, you got to individualize, you know.
Okay.
You could probably take 50, I could probably take 5. And we're going to be different. You could be on your antihypertensives, and I could be on the same thing. And the two of us are going to react differently. How we take it, when we take it, just our own body structure.
Okay.
Yeah, I'm sorry, I don't think I can be more general than that, but it's, I'm just going by patient by patient. I am going by the book, but I'm following my practices, working with the patients, and I am so cautious with them. And I'm one, being in long-term care for all of these years, my job is my job, I feel ethically, I really need to reduce some of the doses that these patients are on. You go into a long-term care nursing home, and these people are on 15 medications, seriously. You know, so I'm trying to reduce it, and I know we're not doing cannabis here in the United States. I think it's coming. We'll see as of, when's the 17th? Wednesday, what Canada does. Canada is going to be distributing cannabis to long-term care. So I think there's going to be some really, really good stuff we're going to hear. Yes, I heard 500 nursing homes have already are looking into it. So I think I am so excited, especially being in you know, I've done nursing homes for 20 years, and we are both very excited. You know, you're still in the trenches every day. So prescribing, dispensing, documentation. There are no prescriptions. When I talk to doctors, when I do my education in doctors' offices, but I don't know what to write for. No. All you need to do is say that you are working with your patient can't. Now in Illinois, the doctor cannot recommend cannabis. The patient must come to the doctor. This is Illinois, we got. Listen, we're happy we don't have fingerprinting anymore. We finally stopped fingerprinting these people. And who do you think were the ones that couldn't get fingerprinted? Were my 55 and over. Some of them don't have fingerprints anymore. So a letter would come 90 days later, sorry, because they have no fingerprints. But thank you, Governor Ronner. August 28th, no more fingerprinting. These patients can come in, fill out their application. The doctor fills out. All the doctor has to say, yes, you have to, you know, one of the conditions, and then sign off on that. That's all he has to do. And there is no prescribing, which now, here we go on the flip side. When I'm speaking to doctors, a lot of them come back and say, I don't know, my patient goes to a dispensary and there is what's called a bud tender. And I say, no, we're clinical cannabis consultants. And then the question is, oh, and how many years of training do they have? And I say, well, they study it every day. They are very active with many, many patients. They know all of the different types of products, and they have to get continued education once a year. And the doctor said, that's nice. That's nice, but you're not telling me what I'm asking you. So with that, we kind of, so we try to get more pharmacists involved. I'm going around to the different universities, U of I was at 2 universities in Illinois, I've been to Long Island, again, we've got to get more clinicians, we have to get nurses trained, we have to get pharmacists, everyone in healthcare needs to get trained, because your patients are getting trained quicker than you are, and that is sad, that is sad. Dispensary overview, yes, I have 2. Again, in Illinois, we are very, very, very regulated, and each of my stores has 32, we have 32 cameras, so unless you're in the bathroom, otherwise you are cam to camera, that film goes directly to the local police department and to the state of Illinois. Documentation, again, we document, just like in any pharmacy, when our patients come in to speak to whatever they're purchasing, the cannabis consultants put everything in the computer. Also, how was your reaction last time? How did you feel? What did you take? Blah, blah. And then we give a little booklet for the patient. Please fill this out for us so we know how you're feeling and what is working for you. This is Illinois. What can you prescribe for my side effects of pain, nausea, and lack of appetite? And the Illinois doctor said a round-trip ticket to Colorado. So, yay, right? NIH, I only have 1 more minute, so we know there's an opioid crisis going on, and Illinois, our governor just signed the new opioid alternative pilot program. We should get our first protocol coming out December 1st, and by January 1st, I think we should go live. Patients will be getting a 30-day medical cannabis card. Of course, they have to come in and show that they are on an opioid and they're trying to get off the opioid. We do not have any of the details yet. So I think that's going to be very, very exciting. Illinois does not have chronic pain or retractable pain on its qualifying conditions. We have some strange things. Oh, yeah. So cannabis can treat, improve, help, lessen, reduce. We are reducing polypharmacy. As a pharmacist, I say, hands in the air, yes. Why pharmacists? We're equipped to rationalize, we give them a scientific approach, we meet patients, we're offering guidance, and we're providing a clinical advice. Attitudes are changing. Are you ready? Anybody who watches Jim Cramer, I was at his conference this past Saturday. There were 400 CEOs of different companies all across the United States. As I was listed, very positive in there. There was a lot of good energy. He had a couple of programs on cannabis. It was amazing. So I'm hoping, again, for my younger patients that are working and they still have to pee in a cup, maybe some of these CEOs are going to take this into consideration and not just look at buying stock, but taking care of their patients. So individualize, engage others, talk about it all the time. Here are all of my references, and some of them you've met today.
Can you go back 2 slides? I just want to
course.
capture your
All right.
argument for pharmacists.
Yeah.
One before that.
Attitudes are changing.
Yeah. There you go.
All right, pharmacists. This is us.
One more behind that one?
One more behind.
Yeah. Thank you.
That leaf, don't you like that? That's my logo from Mature Approaches to Cannabis. So, in all things of nature, there is something of the marvelous. Think that one out, and that's by Aristotle. Okay? So I found that on the tea bag. So, you know what? You have to find things where you have to find them, right? So, any other questions? Yes? Hospital, I'm glad you asked that question, because I just had a patient who brought his son to the hospital, and with a list of the medications of this child who has seizures, and on there he said, my son takes CBD, and the pharmacist had a total blank look on his face. What is that? So, until they start learning, until I start hitting up on hospitals, until the pharmacy schools start pushing this, and all clinicians, including the nurses and just everyone, that CBD is alive, it's there, it's coming to your place. So know about it, especially as clinicians. I had one of my students last week in Illinois tell me that a patient called a a pharmacy, I'm not going to say which one, and asked the pharmacist about CBD products. Blank face, I really can't help you, I know nothing about it. So it's again, we need to really push that education. So everybody in here, just, you have to push it, yes.
So as a clinician, what would you, I mean, just to kind of sum it all up, what would you say are the main things that, like, you know, the warfarin, it lowers?
Yes.
What are some of the main, like, the most important, like, the ones that you gotta flag? What would be the best?
For the drug interactions,
Yeah.
definitely warfarin, because but then warfarin doesn't like any drug. So why should it like cannabis, right? So that interferes with everything. But definitely increase monitoring. Blood pressure, increase monitoring. Whatever drug you're on, whatever, talk to your doctor, make sure your doctor knows. The other thing I'm finding with patients is compliance. Are they compliant with the cannabis? So once you're on cannabis and you're going to start reducing other medications, that's so very, very important that that you have to take that blood pressure every day. Your blood sugar, that's another one. Cannabis can reduce blood sugar. So if you are on insulin, if you are on any of the orals, it's very important that you have to monitor. It's really, now when I talk to patients and I go to independent livings, I said, all right, you're responsible. It's your health. You're responsible. You got to kick into this. It's no longer go to the doctor, get a prescription, go to the pharmacist. Pharmacist says take 1 tablet a day or 3 times a day or whatever. We have to all take, we now as patients have to take responsibility and also individualize. And just like I said, compliance or adherence, whatever the new buzzword is, that's an issue with pharma drugs, and it's an issue with medical cannabis. Yes.
Do you find it difficult for your patients to keep up with the ongoing journaling and just recording of their...
So far, no.
Okay.
Yeah, I think because it's new to them. I mean, I'm not getting, it's just a little mark here and there. And you've been doing journaling. Are you getting any patients that are giving you any...
Yeah, they find it too difficult to read. I think it's easy for the first start.
Are you guys able to implement maybe some sort of more standardized form setup to make it even easier process? And they're still having problems with, right?
Yeah, or if there's a caregiver, it always helps if there's a caregiver there to help and do all that. So.
Thank you.
Thank you, everybody.